everyone. Thank you so much for coming to PechaKucha Night. This is actually my first experience with PechaKucha, so please bear with me for any road bumps I may encounter along the way. I'm going to be talking about health impacts and data reporting related to the BP oil spill. So I'll jump right in. According to the nurse practitioner at the parish medical tent on Grand Isle, she is only allowed to implement the use of Band-Aids and ibuprofen to treat workers. Otherwise, anything more severe is sent directly to BP EMS, where they keep their information strictly confidential. Also, reports from workers who were hospitalized, they say that they were given adequate training and quote-unquote appropriate protective gear. Also, statements from BP say their internal air quality data does not warrant giving workers gas masks. Statements from workers say that they were not allowed to use gas masks and they were told they would be fired if they did so. In an interview with CNN, BP CEO Tony Hayward said that sick workers probably had food poisoning. In a response from the leading health expert on foodborne illness, he said that this is not the case. Their symptoms do not correlate with food poisoning. They are respiratory in nature, whether or not they are attributable to being exposed to the oil spill. I'd like you to take a moment to reflect on this, put yourself in the shoes of the workers, the people on the front lines, before I move on to the next topic. This is a table you can find on EPA's website. You can see it's a bit confusing, lots of information presented, so I can imagine to the average layperson it wouldn't really be very helpful. This is a prime example of why we need transparency of data reporting and easily accessible public information. A couple of the methodologies being used to sample the oil spill are planes flying over taking air samples, which have been largely ineffectual because it's too hazardous to get low enough to get adequate readings. Also, the Taga bus is a mobile laboratory that drives up and down the Gulf Coast taking samples of the primary constituents in the dispersants that are thought to provide negative health effects. This is a map of the southeast Louisiana route the Taga bus takes. You can notice all the white dots along the route are representative of detectable concentrations within and around our communities. This is where the bucket brigade comes in. It was originally started to give communities a voice, to give them power to fight back when they were told that as their loved ones were choking and dying, that there was no problem with their air quality. EPA has come to accept bucket results as being perfectly acceptable and usable. The Bucket Brigade uses an EPA-approved bucket, which is a simple, community-friendly tool that they can use to take air samples. They are relatively inexpensive, this empowers communities, and they can build and operate their own air monitoring systems. This allows community members to give informed responses regarding specific chemical readings in their samples in order to hold institutions accountable, to hold them accountable for their health and the health of the environment. It allows people to report from the ground up what is going on in their neighborhood and to disseminate information. This is an example of the tool used by the Bucket Brigade. It is representative of incidents of health effects that individuals are documenting from the ground up. Each orange dot along the Gulf Coast is an incident of a person who has reported a negative health effect. We can zoom in to the greater New Orleans area where we find several reported incidents. For example, oil odor, burning eyes, nasal irritation, headaches, nausea. The intent of the maps will be lost without proper funding and if we don't have outreach workers on the ground and people reporting from the ground level. The severity of the health impact to the actual city is highly dependent on what hurricane season brings. Should a hurricane hit and disperse oil into the lake and the river, our drinking water supply would be compromised, as would our air quality further be compromised. Another hazard is the issue of several ozone action days that have occurred since the rig explosion. This means that it is highly inadvisable to stay outdoors for prolonged periods of time or to participate in prolonged outdoor exertion or exertion of any kind. It's currently unknown if there's a correlation between the two. We need to demand access to comprehensive, understandable information. We need to protect high-risk communities. There are people crying, pleading for relocation to save their families, to save their children, to save themselves. We need to give these people a voice. A way to do that is to implement more bucket brigades. It's an easy, low-cost tool. People can be trained very quickly, and it only takes $500 per sample. More funding and resources are needed to hold institutions accountable. Now, I'm not here to place blame. I'm here simply to raise awareness, to give voice to the voiceless. It is up to us as a community, as fellow human beings, to take action, to unite. We need to save the Gulf. We can save the city. We can save ourselves, and we can save the planet. We can be the solution. Thank you. If you'd like more information, you can contact me through FutureProof's website, www.futureproofnola.com. We're also on Facebook. To find out more information about the Bucket Brigade, go to labucketbrigade.org. They are also on Facebook. To get a copy of my presentation, I would gladly send it out. I didn't have enough time to go over everything in 6 minutes and 40 seconds. So thank you, everyone. I hope you have a wonderful evening.